Hi guys, welcome back to the Unposted Podcast. Today I have a very special guest coming on the mic, and I really think it's an episode everybody will want to listen to because I think you're really going to get a lot of value out of this episode. The guest I am having on today is Dr. Jessi Gold. Dr. Gold is the Chief Wellness Officer for the University of Tennessee System and an Associate Professor in the Department of Psychiatry at the University of Tennessee Health Science Center. She is a fierce mental health advocate and a highly sought after expert in the media on everything from burnout to celebrity self-disclosure. In her clinical practice, she sees healthcare workers, trainees, and college students. Gold is a graduate of the University of Pennsylvania, the Yale School of Medicine, and Stanford Medicine. You guys make sure to find her on social media at Dr. Jessi Gold. And today is extra special because she actually just released a book called How Do You Feel? I actually read the whole thing in 3 days, which is unheard of. I don't read. And for me to actually finish a book in 3 days, I think speaks to how good a book is, especially coming from somebody who takes like a year to read one book. And I'm not even kidding. But this book it's a memoir following a psychiatrist, Jessi Gold, and 4 of her patients as they deal with the unspoken mental and physical costs of caring for others. So what I found was, even though this book is geared more towards healthcare workers and people in that profession, me not being in that industry at all, it definitely resonated with me from the side of everybody has these struggles and these thoughts and these feelings that they go through every single day. And I'm really excited to learn more and chat with Jessi on the mic about her experience writing the book, publishing the book, but also everything inside the book. So take a listen, guys. All right, guys, I'm so excited to introduce you to Dr. Jessi Gold here with me in person, which is crazy because we actually connected over Threads.
Yeah.
And I know I say this on my platform all the time. If you guys aren't on Threads, you need to be on Threads. I think it's a great way to grow your community in whatever direction that you're trying to grow. But Dr. Jessi Gold, how are you?
I'm good.
I guess, how are you? How do you feel? I guess you're here in LA.
Yeah.
You're on a little book tour.
Yeah.
All of that.
I think it's tiring, but I think in a lot of ways also great because getting to talk to people about stuff you care about is the reason you write something like that. And so like getting to go out and talk to people about the book or have book conversations where people show up feels like, like stories can change culture. And so it feels very much like you're doing what you're doing for a reason. And that's really nice because otherwise it's just like, I wrote this thing and here, world, enjoy. You know?
You get to talk about it. And I'm somebody that loves like to read something or see something, but then to meet the person, it takes that connection so much deeper. So I'm very honored to have you here. Having read the book, and guys, if you know me, my family, whoever's listening, my friend from school would be shocked to hear that I read this book, guys, in 3 days, okay? That is unheard of. I take a year to read a whole book, if that. Like, I do not read. But I genuinely was so, like, I was reading and the time would just fly by. And that's how I know it's a good book or that I'm getting something out of it, is when I feel like I'm not doing a chore, because sometimes reading feels like that for me. And again, obviously, I'm passionate about mental health, and like I felt really seen and heard by your book. And before we get into your book, what, I guess for the people that don't know you and don't know anything about the book, if there's like an elevator pitch you can give regarding what the book is about, then I think that would be really helpful. You can
tell me if it's really off. But I think first I'm honored that you like read it that quickly. It was really important to me to write something that felt easy to read and had short chapters, and people wouldn't like be like, oh, I have to read before bed and I have 45 more pages and this is miserable. So that's really important to me. My therapist said something similar to you, which was like, I read very slowly. I'll let you know when I'm done. And it was like a day, and she goes, oh, I finished that already. And I was like, yes.
Yeah.
So elevator pitch wise, so it's part memoir, part patient narrative. All of the patients are healthcare workers or healthcare worker adjacent, meaning there's a pre-med. And it follows me and them forward and really looks at the challenges taking care of yourself when you take care of other people.
Yeah.
That's the elevator pitch.
Yeah. I know people always ask me, what's your elevator pitch for what you do? I'm like, so many things. I don't even think I can put it into an elevator pitch, but I do agree. That was a great elevator.
It's an oversimplification of all things, but I guess that's really what an elevator pitch is. It's like, what are the things that maybe someone can get out of it very quickly?
Yeah. I know this book was, it's about the healthcare system and like your patients and your personal experience with being in healthcare. But as somebody who I'm not in healthcare or know anything about being in healthcare or that industry whatsoever. And why I wanted also to talk about the book so much is this book helps beyond healthcare, people in healthcare. Like, obviously, again, not in healthcare, but as I was reading it, I felt so understood. And I think it gave me a perspective like, wow, if people that we look up to, in healthcare and people that we go to for help are also feeling the same things that all of us, are also feeling. So I want to go back. How did you get into, like, what, I know you have some parents, your parents were both in healthcare. Did that motivate you to also follow in that path?
Like, yes and no. I mean, I think so. My dad's a psychiatrist. My mom has a master's in public health. I grew up thinking smart people were doctors. And I don't really know why. It's not like my dad ever was like, smart people become doctors, because that would be weird because he was one. Like, he didn't do that. But I was around like a lot of other doctors. My dad was academic, so we'd like go to talks when you're younger. Like, I was like a little kid listening to like very advanced like biochemistry of the brain stuff, and they were like, who's that random little kid in the corner? And I'm like, I don't know how I got here. And so I was exposed to that all the time. And so like when my parents would say like, you're really smart and you're good at school and I'd get good grades, I would think that meant I had to be a doctor. And so I have no idea like why, because they probably would say they never told me that, but that's really what happened. And then like I did all the things you have to do to be a doctor, but mostly hated them. And so then I was very confused because I was like in college taking those classes and going, oh, these people are miserable and all these classes are miserable, like how maybe I'm in the wrong thing, or maybe like I'm wrong. And then people would say stuff like, no, but you've always wanted to do that. And like then you start to think like, oh, it's a challenge. Like these classes are hard, and if I actually like am good at this, I can prove that I deserve it. And then you like start to like, instead of taking that as like a reason to doubt, like, oh, turns out maybe I shouldn't do this, it's like, oh, but I can anyway. And so you kind of get in your head about that. And so even though there are lots of steps along the way, which I talk about in the book too, like where I was like, I don't know about this, I never really veered much because I always thought that's what I was going to end up doing. Psychiatry for me wasn't necessarily what I thought I would do either. My dad's a psychiatrist, but he doesn't see patients, so I never really saw like patient care as part of it. And then really didn't want to do what he did, like had an obstinate kind of belief that I shouldn't. Probably some Freudian thing there, where somebody would say like, I was trying too hard to not be him, that I became him, right? Or something.
Exactly. Like I just was supposed to be that way.
Like there's something like that. But really what happened was like everything in med school, like I'd be sitting with people and want to hear more and spend more time with them, and none of the other fields did that. Like they just either it wasn't part of that field and that's not what they did, or they couldn't because of like time constraints on the way that they practice. So like people who do internal medicine, like if you go to your primary care doctor, they want to spend time with you. They just can't because their schedules have people every 15 minutes, which is just like bizarre. And so, psych was like the only place that still had that, and also really focused on like people's stories and where they came from, and that mattered. So it wasn't just like, yes, we diagnose people and yes, we treat them, but it was like, but how did they get there, and what about them brought them there? And even if I saw like 100 people who all technically had depression, it wasn't just like depression, drug, the end. It was like, ooh, let's talk about their childhood, and like, ooh, let's talk about all these things that went into it. And so like that was much more fascinating. So it kind of just won out in the end, despite trying to fight against that in so many ways. But, I think that I'm glad that as somebody who isn't in medicine, you like the book, because I think that you know, the struggles are uniformly true for a lot of people, like overwork, overachieving, perfectionism, like stigma, all these things are like common themes. And I think presenting them in healthcare does make it kind of like this weird niche of people, but also like you go to doctors or nurses and you don't really understand how they get there, but you have these beliefs about who they are and how they got there. And then if you interact with them and they're horrible to you, then you get more beliefs about what that is. And so I just felt like it also pulled back the curtain a little bit. And like, if we're human, all of us are human. And if like we have stigma, like of course you do, like that sort of thing.
Yeah. And from somebody who, you know, I've been in and out of doctors, you know, obviously throughout my whole life, like, and I've always been terrified of going to the doctor. And I think a lot of people feel that way whenever people have to go to the doctor. Oh, I have to go to the dentist. Like everything, it's like scary. You know, I thought back when I was little that I wanted to be a doctor until I got like a paper cut and passed out. I was like,
guess not.
Cannot go and do any of that. That's just not going to happen. But having a fear of obviously things that go along with going to a doctor, getting tests done. It's uncomfortable, but the biggest difference for me is whoever my doctor is, like finding that person that I feel like I'm not just a number, just like another patient off their checklist. Like, you know, feeling the human connection is really big for me, especially for somebody who is like scared, has a real fear of going to the doctor. Finding the people that do care and do show emotion for regular humans, I think is super important. And I know you have talked on this throughout, you know, your whole book about, you know, how doctors feel like they can't show emotion because it's not, you know, it's frowned upon within your own community. And I just want to be like, that, show more emotion. Like we want to see, like if somebody cries with me or like shows like actual care and asks all the questions, like I'm like, oh, I'm safe here. And so peeling back that curtain, even knowing like this is kind of part of their job, even if they're not giving me like, you know, what I feel like I need, like empathetically, at least I can know this is kind of like the stigma in the healthcare world, that it's okay for me if I'm not, if they're not overly empathetic, because I am overly like emotional. So so it's awesome if I find a doctor that, you know, matches that to a degree, but if not, at least now I know after reading this, like it's more of like how they're perceived in their work.
Yeah, like we're basically taught not to have emotions,
which is just crazy.
Which is, it's weird and like doesn't make sense to patients. And like a lot of the data would say similar to what you're saying, like patients would prefer us to be more like open and emotional in some capacity to like show that we have empathy and higher patient satisfaction that way. But really, like all along we never see it modeled. Like nobody's showing emotion, like nobody reacts, like people die, nobody does anything. And so you're like,
that was insane to me.
Like I guess that's just what you do. And then they'll say things like, you're making it about you, don't make it about you. And so you have like this thing that's like emotions detract, emotions make it like self-centered in some way, and we're in this field to take care of you, not us, right? It's not about me, it's about you. And then at the same time you never see it, or you get really negative feedback about it. So like all the people who are a little more like empathetic and attached get called people with bad boundaries. Or like for me, I was told like I didn't know my place, right? Like and that was just because like I don't have a brain filter very much, and sometimes when like things get like don't seem right to me, even if there's a hierarchy, I'll say something and that doesn't go over well in a very hierarchical field. But you know, you have all those like messages, and the messages are basically like don't. And so you don't. And because you also have all these other layers of competition. And so like if you show emotion and then they're going to say bad stuff about you, then you're like, oh no, like I'm going to lose. Like I'm not going to get the next step, the next thing somebody who's not emotional will. And so you kind of like stuff it down because that's what they tell you. And that's what's successful. And that's what being a doctor means.
It's the competitive side of like the industry.
Super competitive, like every step of the way, obviously, and like never really stops in the sort of climb of it. But
definitely.
I also think like, you know, being told that it's like wrong also makes you feel bad. Like, you know, if you were in a situation where like someone died and you wanted to show emotion, you'd like kind of try to clamp down on it because you'd be like, oh, I don't have a right to have feelings about this. Like, that's not my sister, mother, dad, whatever. It's just a person I'm here to help.
Yeah.
And they convince you it's self-protective too. Like, they try to convince you that somehow, like, learning not to feel will help you do your job better because it won't affect you. And in some capacity, that's true. Like, if all day, every day we felt everything that we heard, we wouldn't survive. No, like, it's just not possible.
Definitely not.
But, like, we don't have any moments where we're allowed to, like, even at the end of the day or between
just
people. And like, that's the problem, right? If you never do, that's one thing. But if you sometimes do, you're probably better off. You know?
Definitely. Even, you know, my life has... I couldn't imagine, you know, working in, you know, like the ICU, like seeing people like consistently, you know, pass away or, you know, come in with traumatic injuries or whatever the case may be. Like, I couldn't imagine brushing that under the rug for an entire lifetime. Like, even me in my 10 years of being LA, I've brushed stuff under the rug and now I'm like, oh crap, okay, I need to dig those out.
I mean, you push it down sort of like a beach ball and it'll fly back in your face, right? Like, much harder, right? You know? And I think we think like it won't, but like, you know, stuff like that, especially trauma, like it'll come out 10, 15 years later and you're like, I didn't even know that was a thing. Or like, there's a character in the book, like Megan, who like pretty much never felt and then realized she also never felt about anything, right? Like in her social life, in her interactions with other people. And that happens a lot to healthcare workers. Like, they'll be at dinner and someone will be like, how's your day? And they're like, oh, this and happened. And it was like, I saw kids get shot, right? It's like this, you know, just something that most people can't just rattle off. And then they look and everyone like, else in the table is like crying. And they're like, oh, something's wrong with me, right? Like, and that tends to be like a eye-opening thing for them, but they're so used to not doing that it's like, it's super weird. But yes, pushing down stuff doesn't work very well. I think we're getting a little better at talking about it, probably not as good as we should be. I think people always say things to me like, it's brave that I do, and I'm like, it should be boring. Like, being brave, like, by telling a pretty boring story about burning out or having depression and being on meds, like, I'm sort of like, like, I really wish like enough people had talked about this where it's like, oh, like, it's just another one, like, there she goes again. But now it's like not enough of us, so people say stuff like that, and I'm like, okay, I mean, I'll deal with it, but hopefully someday, like, me doing it will make it easier for other people to do it, and then they'll be like, oh, she was just early in the conversation, but the rest of us do it now too, you know?
Definitely. Like, towards the end of the book, it was either Megan or Janet. I got the couple names. She cried with her patient at the end, and stories like that. It was like, you know, you encouraging them to open up and just feel their emotions. I was like, oh, like, that was like such like a sweet moment to read, because my whole life, even growing up I was a gymnast first, where it was like no crying, no emotions, and it's like I'd be like holding a handstand for 10 minutes and it's like, you can't cry, like, there's no crying, like,
they just really make you do a flip with a broken leg, like Carrie Strug or whatever.
I remember I was doing my pull-ups and we had to do however many, and I remember I was getting to like number 10 or something ridiculous, because gymnastics training is insane, and I was trying to reach so much, I hurt my neck. I was straining my neck, and I remember going and telling my coach my neck hurts really bad, like, and I was like crying, and they were like, there's nothing wrong, you're fine. Like, I'm like, no, I'm not. Anyway, I went to the doctor, I was not fine, I had strained my neck. Like, you know, so it's stuff like that where it's like I wasn't allowed to feel. And then also with my family, like, it's not their fault, but you know, we didn't cry or show emotion in our family that much, and I'm an emotional person. So now it's so funny, since I moved out to LA and kind of separated myself from my home environment, I notice I'm even more emotional now with everything than I ever used to be. And then when I go home, they're like, you're so emotional. I'm like, I don't know. I just like feel like I'll be driving, and if I see a car accident on the side of the street, like, I'll start crying. And I'm like, oh my goodness. Like, it's just crazy how I feel like the scenarios that we go through in our life, like, depending on who we're surrounded by, alters how we act and like how our emotions come out. Because I would say now, if you ask George, like, I'm the most emotional person ever, but growing up, I was like hard as a rock.
Yeah.
But it was because I was influenced by the people telling me, no, you can't feel
those.
those.
Or if they tell you you're the emotional one and you're barely showing emotions, you're just like, oh. And I think also with women, and I also think with women, there's like this big emotions. It means like something's wrong with you, and like you're not going to be a good leader. You're
oh
not
my
gonna
gosh, you're so hormonal. Like you're crazy. Yeah, especially being a woman.
So I think it all kind of compounds, and then you're just like, I think maybe I'm fine just not having any.
Absolutely. Yeah. Whenever, I guess I want to ask the kids that, you know, you work with that are college students that are just getting into the medical field and going through that process, is it an eye-opening experience, I guess, for them to be like, oh, wait, I can't show emotion? Or is it pretty well known? Because I didn't know. Like, if I decided I want to go into medicine, I would have no idea that that was like the stigma, honestly, until reading this now.
Yeah, I mean, I think it depends on how it comes out. Because if it like comes out in the ways where it kind of did for me, where it was like really hard hierarchical situations where I was treated badly in the context, like that can be really hard.
Absolutely.
But if it's like you just kind of all of a sudden are different, like I don't know that it would be as obvious. Like I think some people kind of subtly change because you see it modeled and you become a certain way, but it's not like this night or day thing, and it's not like this, oh, I'm not allowed to do that, so I'm gonna stop. But I will say, like, you know, I'm a millennial, like the Gen Z, Gen Alpha folks are also like, why is it this way? Stop all of this, right? And they want that with a lot of things, and they say sort of like, I don't get it. Like, why is this the way it's supposed to be? And like, why can't we do it differently? And they feel that about so many things. And I think medicine would be one of those fields where they really like are going to push it and probably not go into it if it doesn't shape up. Yeah. But I think that those folks can have a harder time because they just don't understand like why it's that way. Right. Like I gave a talk on wellness once, and afterwards somebody was like, what's wrong? Like, why are they so sensitive now? Yeah. What did we do to them? And I was like, is it sensitivity or awareness? Yeah. And they're like, what do you mean? And I was like, well, couldn't it just be that it's always been wrong and they just actually will tell you that it's wrong because they know it and they're allowed to say it and they've been given the freedom and like ability to say it, and you weren't? Yeah. And they're like, oh, I mean, I guess that makes sense, you know? Right. But it's like, just because you see it and you want it to change doesn't mean like an institution that's been one way for a very long time is going to change tomorrow. And like a lot of the things that cause burnout in medicine, but honestly, like a lot of workplaces is sort of like that stuff that's there that you can't fix, like that's been there for forever, or like in medicine a lot of it's from outside forces like insurance or all these other people and places and organizations that are like behemoth things that like changing them would be like honestly a stroke of God. Like it would be like so much work to change, but like those are the things that are leading to a lot of this stuff, and like people can't see why that can't change any quicker or anytime soon, and that can lead to a lot of frustration, I think, in the field, or burnout too. Yeah, definitely. I know burnout is a lot what you talk about, and hearing your story, like especially through COVID, I think everybody has a very unique experience with COVID. And of course, you know, we were to see all, you know, a lot of health workers talk about it on TV, is like the hospitals, and like I was lucky enough to, I did get COVID, but it wasn't bad, so I didn't experience it at an extreme, you know, in an extreme version, and neither did any of my family, like, thank God. But, you know, seeing it on TV and everybody, it was like, what is going on? And for that transition for you, I guess I just kind of want to, what was that first initial transition like for you? I know working in person in office to then having, how long were you in your home environment? I mean, it felt like forever, to be honest. Like until really they opened it up, which was like post-Delta, right? Like over a year probably, like post-vaccine, post-Delta. Psych went pretty late because it wasn't urgent, right? So we got moved. You talked about the not feeling essential part of it because you had to go be in your home. Yeah, like that was weird. And that's something that I found like later in reflecting. Like I felt a lot of guilt being at home because so many other people and the people I was taking care of were not allowed to be, because that just wasn't our job. Like our job was to be there. And so I was like, I had a lot of guilt about that. And I think it made me kind of overcompensate and do too much, which like I've realized later. And I think probably is a big source of the burnout, was like the underlying guilt of like not actually being there and also not really wanting to either. Like there's a part in the book that's pretty clear that I was like, well, I'm home, why do I need to go in now? And family members were like, I can't believe you wrote that out loud. Like, people are going to be like, what? You said that out loud. And I was like, it's really how I felt. Like, it wasn't that, like, I didn't think I should. But at that point, I was like, well, I've been here. I'm home. Why do I have to do it now? Like, this is silly. But, you know, I think for me, I was, you know, I went from seeing patients in person like 100% of the time to seeing them at home 100% of the time. And we had never trained on like telehealth. So like I'd never even like done it, right? So it's very different. It might not seem like that to people, especially if you just started therapy for the first time and you've only been doing virtual stuff. But like when you like go through psych training, like you watch video of yourself and you get feedback on the way that you interact and the things that you're asking and your movements and all this stuff, right? And so you're like hyper aware of like your body in space, other people's body in space there. And you know, when you're behind a screen, you like lose all of that and you're like, I have to figure out how to be good at this because I don't feel as skilled because no one ever gave me feedback on a screen.
Away from you essentially.
Big part of my skill set, honestly. And like, I think we learn to connect and be open and trustworthy through some of the things you do with body language. Totally. And without that, you're like, I don't know why this person would trust me. Like, I have to figure this out. And then, you know, on top of it being at home, like people would sometimes like be driving and get on their call or like be smoking a cigarette in the park, like, just, like, and get on the call, and you're kind of like, I just feel like you never would have like smoked in a visit with me before. Is this really what you think you should be doing?
Right.
But you know, I think that it was just like a very different experience for me to like adjust to and feel like I was still doing my job well. And then on top of that, like obviously people weren't really getting better because all of the stressors were not changing, right? And so like in medicine especially, you sort of learn like problem diagnosis, treatment, fix you. Like we like very much want to fix you. That's a problem always because sometimes things are chronic and also sometimes like things can't be fixed, right? Like palliative care comes into mind for that. Like we just really want to like try as much as we can to extend and whatever. And I think psych fits in that model some, even though we do get psychotherapy training, I think we like meds can really help. And so we see it and we've seen it. And so we're like, why are none of these people getting better? And I had a pretty hard time with that because I'd be like, literally everybody is stressed from COVID and being a healthcare worker in COVID, and I can't fix that. Like, what is a med gonna do? Like, what am I doing? And I felt very ineffective too. And so I think like being behind a screen and losing skill set plus feeling ineffective plus having all that guilt was a whole new thing for me, for sure.
Oh, I'm sure. And especially because people are going to you for help, but you're also figuring out this, like everybody was going through a transition. So it was like, you have the people coming to you that are going through their transition with COVID, but also you're going through your transition with COVID, and then you had your own therapist, you know, who helped you with your transition through COVID. So it was like everybody leaning on each other and just figuring everything out, I guess. Like, I mean, for the whole world, it was crazy, but I know especially for the healthcare system and people who worked in healthcare, it was like, what is going on? It's like, I know my dad had to have like surgery during the time and they had to push his surgery off like months, like just like people,
because it was non-urgent.
Yeah, my dad's like, I can't walk.
Like, he's like, it's urgent to me, buddy.
Exactly.
Let's get it going.
So I don't know if this is normal.
Okay.
I burn out fast. I feel like I'm someone who is always, I'm really passionate about something and I find what I want to do. I'm like, this is the career path I want to do. This is the hobby I want to do. And then I do it so hardcore and intensely, and then I get burnt out super fast. Is that normal?
What does that look like in you? Like, what does burnout look like for you?
I mean, whenever I'm like, I just don't want to do it anymore. Like, I'm like, this isn't inspiring to me. This isn't like a passion of mine anymore. And I always feel like I'm trying to find the next thing that's going to make me happy, you know? And I've had a lot of people on my podcast talk about this. Like, they're constantly trying to find things that fulfill them.
Burnout's one of these, the reason I asked you like what it was like is I think it's one of these things that we say a lot but don't always know what it means. And so for me, like, we use a definition that's like a constellation of three things, all sort of workplace associated, which I think is important for people to know, and is not in like a psychiatric diagnostic manual. So it's emotional exhaustion, which is like at the end of the day you're just like spent. Then it's like a either, depending on who you ask, depersonalization or cynicism. Cynicism's like anger, and depersonalization's like disconnection, like feeling like nothing really, to be honest. And then the third is a reduced sense of personal accomplishment, like you're getting less done. I think what I would say to that is I wonder if, like, for you, there are things that you don't notice and then you only notice when it's bad and then you're over it. And so it feels really fast, but maybe it wasn't. Because I think that's what happens to me. And I think it happens to a lot of people where it's like, oh, like work or, interests are supposed to be tiring. They're supposed to make me exhausted. They're supposed to, like, I don't know, I am angry. So what? Sometimes I'm angry.
Like, it's not always going to be like, oh, this amazing high feeling like I'm doing.
And I think with jobs, especially, like, I think we very much can write off most of the signs as if, like, okay, everybody looks like that. Like, this whole workplace is full of people who look miserable. So I think I'm supposed to feel miserable. And I think that's how healthcare for sure is.
Absolutely.
But I think that what can happen as a result of that is, like, you blow off all these, like, earlier stuff and then, like, I don't know, all of a sudden in your quick kind of time scale, you're like, oh my gosh, I hate this.
And then it's like overwhelming. And then it's like I'm crying at work kind of thing. Where I'm like, what happened?
Like, maybe it wasn't as fast as it feels, but maybe, like, it comes on pretty intensely when it does. And then it feels like it just keeps happening like that. And so I don't know if I would say, like, it's rare to have it happen quickly, but I think it's actually probably in most people not happening as quickly as we, like, see it because, like, we don't pay attention to any of the early stuff. So, like, for me, early warning sign is, like, if I get really mad at emails, not like sort of mad at emails,
but like mad.
I'm gonna I'm gonna throw my computer mad. I've like broken a phone because of that, and that's like a lot, and I probably shouldn't have even said that. But for me, it's like, and I figured out that it's because, like, emails, like, people are not like, hey Jessi, I just wanted to say hi and I love you. It's like, here are 75 other things to do, or like, here's an ask, or it's like people want stuff from you,
of course.
And if you don't have capacity or you feel like you're out of capacity, like it just like makes you mad as a protective thing.
Totally.
And so I used to just be like, sometimes emails piss me off. Like, I guess that's just a thing. And then I realized, like, oh no, like, that's an early sign for me. And I think that, like, what I noticed was when I was, like, asleep every day after work. And, like, that's an obvious sign because I can't do anything, right? But, like, most of the time, if we wait till that, what we end up having to do is, like, take time off, take a vacation, go to a psychiatrist, right? Like, all these things that are, like, much further down the line where maybe not everyone needed to get there. And I think, like, because we aren't, like, paying attention along the way, it feels super sudden.
Definitely. And I know, like, one thing with me and George, we actually talk about this often is, like, we work with a lot of clients. Like, we have a production company, so we film, basically, like, all their social media and advertisements for their companies. And a lot of times, we send them these videos that we work so hard on and film and we edit and we do all this stuff. And then it's like no response. And then we're like, so do they hate it? Oh, we did a bad job. And it's like feeling the need for validation, which we shouldn't need, but as a human being, like, that also I feel like plays into it. If we're not getting enough, like, oh wait, do we suck because we haven't gotten, like, feedback from the last 4 clients, like, that are like, we love working with you, we love that, like, you know what I mean? Like, if we don't receive that from the people we're working with, immediately it's like, what are we doing this for? And over time, of course, that builds, and then the one person will be like, oh, you guys are amazing, and then it's like, oh, okay, maybe I'm not so burned out, and then it's like a cycle. It's like, oh, maybe it's okay. But it's like that feeling of, like, needing validation from people, as at least something that I've been trying to work through, is like, no, I can still be fulfilled in what I'm doing in my work with myself without needing that external validation.
Like, you can be successful without other people saying you are.
Exactly.
Yeah, it's hard to believe that.
And it's like, I think, knowing, like, I'm somebody to jump to conclusion, and I know, like, reading your book, you have voiced similar things where it's like, oh, are they thinking that about me? Or are they thinking, like, the worst case scenario is a lot of times for me, I'm like, oh my gosh, I probably didn't do exactly what they wanted. They probably think I'm stupid. Or they're probably like, what is this girl doing? She looks so silly. Like, I post on social media every day, oh gosh, this girl's probably so dumb. Like, those are, like, where my mind goes. And it's like blocking out the negative thoughts and, like, all the external just like BS people throw at you, you know?
Yeah, it's like, hard. It requires a lot of self-reflection and growth, I think, to do stuff like that. I mean, I've also, like, as a leader in my job, like, thought a lot about, like, that other end. So, like, for me, like, I took applications for something, and the minute I received them, I just wrote, like, I just want you to know I got this, and I'll get back to you when I can, instead of just, like, it goes to the ether and no one says anything. And I also tell mentees, like, if you haven't heard from me, please bother me, because it means it got lost, or like I forgot. It doesn't mean I'm ignoring you, and like it might make you like stress out to have to write me again, but please do it, because I missed it, you know? And so I try to give people like feedback like that, so they feel less like uncomfortable doing the things that would be better for them, you know? And I also put up a ways when I'm traveling for work for the same reason, because like if you're
out of town,
you're like gonna answer your emails like at nighttime, and all these people are expecting you to do it during the workday, and you're not, then they're gonna be angry. And so like I try to think about like what's the other person thinking, and also like what does this mean to me, and how do I protect myself in this situation, and like have had to make a lot of like, I don't know, transparent conversations and kind of rules for myself around that to make it feel safer. And like, you know, that might be helpful. I don't know.
Yeah. I think from your perspective, because you have felt this way about other people, like, you know, receiving a response or validation, whatever that is from a person you work with, do you try to, you know, you give those, hey, I'm going to be out of town. Hey, I'm not going to bug me, because you felt that way?
Most of the time, I think so. Yeah. Like I think it's mostly based on that, but I will say to like people who work with me, like, is there something I should know about like the way that you think about things that would make me a better league partner, you know?
Definitely.
Like people have said to me that like if I write them later at night that they'll feel obligated to reply. So like I'll have conversations like I'm going to really try to delay send. But sometimes when I'm somewhere else and I forget what time it is and I just press send, like I didn't mean to tell you to do it then. So like just ignore it. And that has also been like a helpful, I think, for some people with like, oh no, my boss like told me to do something. And like, you know, and for me, like it's really because I'm not paying attention. Like I'm in LA and I live in Memphis.
And it's like, we don't know what this other person is like going, like I'll get emails sometimes at like 11 at night, we'll get a phone call. We're like, wait, we're just not going to answer because, you know, but it's like, oh, but should we answer? Because then they called and they might know we're awake because we've been on social media lately. It's like finding boundaries, I guess, is like super important, but also recognizing that, hey, they might just have, you know, sent that message because they're busy or they're doing something, instead of like getting in our head all about it. So.
Yeah, the first time I realized I needed to delay send, I sent an email to a student that I was working with at like 3 a.m. And she said, Dr. Gold, do you sleep? And I said, what? Like, what do you mean? And I forgot it said the time.
Yeah.
And she was like, I mean, I just was checking because you sent this really late. And then I looked and I was like, oh man, that was really not okay of me. Like, I'm sorry, I'm going to do better. I sometimes get in a flow and I don't even realize what time it is. And like, that's on me. I'm not great with that all the time. Yeah. And I'm going to really try not to do that for you. But if you see that, just go like, I don't want to be like this when I grow up.
Yeah. But it's not personal. And I think that's where like I have to shift my mind. Like, it's like, it's not personal. And I'm somebody that overanalyzes everything, and everything somebody says is like, oh, they said that. And I'll think about it all day. And I'm like, no, it's not that deep. Like a lot of times it's not that deep.
Yeah, I feel like that's what happens in doctors' offices, right? Yeah. Too, is like I have so many patients with like bad interactions with doctors that end up in psychiatry, whether they get sent there because it's like in their head, or they get sent there because the doctor was like hurt them in some way that made them come. Like sometimes like that interaction is actually because that person has a lot of stuff to deal with and they like haven't said that, or don't know how to say that, or not supposed to say that, or like I often think we're really bad at mental health because we're not good at our own, right? So like I can sit and listen and talk about mental health because it's my job. Right. But if I'm a surgeon, I don't want to hear about that, like, because I don't want to deal with mine. I just want to like operate and be done. And so they're like, feelings, call psychiatry, you know, like get them away from me. Yeah. And like it can feel very bad to people, but I think a lot of it really comes from like our own stuff. Yeah. You know?
Definitely. Do you feel there's like a buildup now because people haven't talked about it again until recently, that like there's this buildup now that's like kind of being unleashed? I feel that sometimes in like just in entertainment, people are more open now, and it feels like this like explode of like feelings and emotions or like experiences in the entertainment industry.
I think more, but still not a lot. Like I sometimes feel like that the people assume that like the pandemic came from the clouds and we were like fine. The pandemic went back up to the clouds and we're fine again.
Yeah.
And I think that's not just an external belief. I think that like healthcare workers would very much like that to be true, so they can just go back to normal, right? And so like as much as they can, the avoidance of it comes back into play. So like, yeah, we talked about it more because we couldn't help it. But I think sometimes they're just like, it's cool, we're good now, we'll go back to the way we were. And so like that's protective almost. So yes and no. Like I get asked to do more talks on this because they're more aware and know that they should, but does it mean that the people in the audience are like, oh my God, thank you? Or does it mean that they're like, this again? Probably the latter most of the time. You know, like one of my disclosures when I give a talk to that kind of group of people is like, you might be triggered, but what you might be triggered for is like just anger. Like you just might be mad at me that I'm here because you don't want to hear it, or somebody else has told you this before and you didn't like the way they said it, or you feel like I'm sent here as the answer to fix your problems and there are a lot more problems that need fixing than a lecture, you know? And like I give that as a disclosure because I can like see the tension in the room before I start. It's not everybody, but it's just like who wants to have another wellness talk? Like it's a weird thing to be in charge of. And so you're kind of like, I'm just gonna come in here and tell you that I like see the sort of dissonance that you have with this topic and like I'm gonna lean into it instead of being like, I'm just gonna talk to you anyway, you know, and you're gonna like me and it'll be better, you know?
Yeah, definitely. The mental health space, like the reason why I want to start this podcast, because I'm like, I don't care anymore. Like if people don't want to listen, they don't have to turn on my podcast and listen. But I know like so many people, with myself included, I'm like, the more I feel like we all talk about it, everybody has their own problems. And it's like, I always say like your problems that you've gone through or your traumas are like your superpowers to like help somebody. Because like, you know, I've been through my own thing. I have met people that are younger than me that are going through the same thing, that I'm like, oh, let me at least let you know, like, you're not alone in how you feel. And that's really the main purpose of like being on the mic and talking about this stuff. Because I'm like, I know so many people feel like they're alone in how they're feeling. And I felt that way growing up. I'm like, I feel like nobody understands, when in reality there's like so many people that have literally gone through the exact same thing that I've gone through. And especially with social media being so, you know, we call it a highlight reel. It's all the positive. So a lot of times I have people that that are influencers, or like people that have a big following, that have all these pretty things and just show the positive parts of their life. Come on here and kind of like let down the curtain and show people their real life. Because growing up, I was like, oh, I'm following these celebrities that I look up to so much, and little do I know, like they're struggling with, you know, whatever they're going on with, whatever they're struggling with. And I'm like, oh, wow, I had no idea. Now I feel less alone.
Yeah, it's really easy to feel alone in this stuff, or feel like somehow you're the problem because no one else is talking about it. Or if you want to talk about it and it seems like everyone else is also dealing with the same stuff and struggling to some extent, like if it bothers you, like what therefore is wrong with you, you know? And I think that is very common, and that's sad but true. And like I see that so much with patients. I also think for some reason there's like this lived experience versus expertise thing. Like people think that we can't have both, or that there's no overlap. Like I have a lived experience. A lot of people who go into mental health fields like have someone in their family or somebody in, you know, in their life, if not themselves, who have had an experience with mental health stuff. And so I think for some reason, and this comes off on social media a lot, there'll be like sort of this therapist side and the lived experience folks, and they just butt heads like they're like fighting about it. And I'm like, I don't understand the argument, because like there's a overlap, like a logical sort of intersection where there are people with lived experiences who are also experts, and the difference is just like training, you know? I mean, and I think we need to be able to say like our stories matter, but like our stories are our stories, and they're not universally like everybody who has this experienced this. But I think it helps people know like there are spectrums of stories and experiences, and like
Yeah.
you can look like lots of these different kinds of people.
And that's, you know, one thing I've like learned even reading your book is there's like a million different paths, I guess, to like diagnosing mental health and like figuring out how to heal each person and how everybody's so different. And like there's so many different medications or different types of therapy, which I didn't even really know. I'm like, oh wait, there's like a bunch of different types of therapy. So if I'm looking for a therapist, I need to, you know, it's like the knowledge of like therapy is not out there, at least for, or I'm not educated on like, oh, if I want to find a therapist, there's all this different type of therapy that I have to go through to figure out what works for me.
Yeah. It's confusing.
It's really confusing.
And I think it's also like people use that title very loosely, like call themselves therapists and stuff. And I think like psychiatry has like a lot of thoughts that people have behind it, which hopefully the book helps, because I'm not like a person who just drugs you and never talks to you again.
Yeah, exactly.
But I think a lot of people think that about us. And I think a lot of people think that we don't care about all of the rest of it and like your story and stuff. And yeah, there are tons of different types of therapy. I think it's hard to know which kind if you've never done it before. Right? You either try them out or you go to somebody who tells you what the right thing is for you, you know, and sort of like triages you according to what's going on. But, you know, like it's kind of breaks down for the most part into, do you want to talk most of the time or do you want to learn skills? Because like there's behavioral kinds of therapy, like cognitive behavioral therapy, dialectical behavioral therapy, like that sort of class of things is like you will probably have homework, it'll feel more skill based, and you won't feel like you're just open-ended talking. Then there's like, we call it psychodynamic, but most people say like talk therapy, and that's like really just you go and you talk and it feels like you don't know why it's working, but it is. And there's a lot going into the talking that is not just like we magically made you better. There's a lot of thought in our head about where to lead conversations and how to get people there. But those are like the kind of two obvious camps. You can sometimes guess based on what you might like or what you might want, but like some diagnoses, like in the book, like there's a guy who has OCD, like do need a certain kind of therapy if they really want to get better, which is hard. Trauma is also that way. There are like a couple of kind of trauma types of therapy for sure, but like those kinds are better to go towards if that's what's wrong with you, because you'll deeper dive into the things you need for that, right? And it's hard. I mean, it's hard to figure that out and even know what you like. And, you know, I think another important thing for folks is like therapy works because of the fit. So if you don't like the person, like get another one. Right. You know, like maybe give them more than one shot, right? Because I think the first time they're asking you like 17,000 questions and you're like, this person's the worst. And then the second time they don't talk at all and you're like, that's different. So, you know, give them more than one shot unless there's a big reason up front where you're like, this person is like racist, sexist, like, you know, something where you're just like, absolutely not. But I think know that like it is your right to find someone that you fit better with, even though the mental health system is inherently broken, and that's easier said than done. Like, because in mental health, like we are the tools. Like we are good because of what we do, and not, if you don't trust me or you don't like me, you're not going to listen to me and you're going to hate being there. Like you're going to be like, why did I agree to sit there for an hour every week?
It's all about trust for me. It's like, if I feel comfortable, then I'm like, I'll tell you everything, and which is going to benefit me. You know, it's like, I'm very like, if I vibe with you, great. Like, then it's a good match. Like, I've switched doctors so many times because I'm like, I don't vibe. The chemistry is not there. You know, I've been misdiagnosed throughout my life where I was like, didn't even run these tests. And then just feeling like, oh, I found a doctor that really cares and will actually do all the, listen to me, you know, with what I'm feeling. Like, I really feel like, maybe can we try to test for this and see this? And just finding the doctors that really mesh with me has made my experience like night and day. I've had horrible experiences and then experiences where I'm like, oh, I love the doctor. Like, I love my doctor, you know?
I think sometimes people think like, I got to sign that person and that's who I see, you know? And like a lot of my college students are funny. Like they just don't know a lot about the system, and they shouldn't, because like someone else probably did it for them for most of their life. And so they'll even be like, I stopped my med, and you're like, why? And they're like, I didn't have any left in the bottle. And you're like, did you have refills on the bottle? And they're like, oh, that's a thing, right? And it's just like education around the system and how to self-advocate. And it's easier said than done, but it's like definitely one of those things that like we need to be better at like admitting that we have to learn it, and it's a skill set, and
Definitely.
it's like,
and it's okay to ask questions. Like,
totally.
I know, like, I'm like, what is this again? How do I, you know, like, I don't know what test this is. Like, I don't know what's happening, you know, like I'll go in and be like, I have no idea what I'm here for, but here's like the paperwork. And they're like, oh, okay, follow, you know what I mean? I'm like, but it's because I didn't ask questions. And I'm now finally to the point where I'm like, wait, can you please explain this to me? I'm not stupid, but I feel really stupid right now because I have no idea what you're talking about. Now there are a couple questions I wanted to get to before we kind of wrap up. Which one's here? Oh, okay. So I've had so my cousin, she committed suicide like almost, I think like 9 years ago now. But growing up, I knew she was super depressed and going through a lot. And I know people have people in their families who are going through things mentally, but aren't able to see it, I guess. And I know a lot of like body language and certain things, there should be things like we look for in our loved ones, you know, to try to push them to get help or whatever that looks like. Is there anything for just like a normal person like me to look for in a friend or a loved one, to try to support them in any way?
Yeah. So the first thing I'll say is like suicide's super complicated, and it feels like your fault or like you could have fixed it, but it's not something that like is that simple, right? And so I think we have that feeling about deaths like that, and I just want to say that part up front, because like I can tell you signs and symptoms and things to think about, but I'm not doing that because you missed something or it's your fault, right?
Oh, right. Yes.
So I just want to say
totally.
and then, you know, I think when you know what your person is like. Yeah. If your person starts doing something that's not like them, that is the most obvious thing. So acting differently, isolating when they don't, not responding to texts or emails in the way that they did, being more angry, interacting with you as a loved one, like because they love you the most, probably worse than they do with anybody else, right? Like their personality is just like not them. Yeah. Those are early signs usually. You know, the things that we look for in depression, like sleep or loss of interest in stuff or loss of appetite, like that you might see if you're like really asking questions. But I think as a loved one, what you're much more likely to see is like these subtle behavioral changes where you're like, is it weird they're not texting me back and they used to text me back right away? Or like, is it weird that they just keep screaming at me all the time now? Or like, what's the deal with that? And like being able to say, like, not in a confrontational way, like, hey, I've had some times where like email really pisses me off too. Like, are you having, like, is that what's going on with you? Or like something where you kind of normalize it and open it up for them to talk about, as opposed to like, I noticed you're not doing this. Like accusation. Yeah. Which happens a ton in the workplace, right? Like if you're doing something wrong in the workplace that feels wrong to them, but really is actually about mental health, they'll be like, you haven't done your work, and you just get defensive or you get angry and avoidant, but you're not going to then be like, oh, let me tell you about my mental health history and why I'm struggling. Like, you're just not, right? And I think we're like that, the same with friends and family. I would say like, make sure to follow up. So like, just because you check in once, like, doesn't mean that like that was the only time, right? So they might be like not willing to share at that point, but maybe they will later. So follow up, super important. Know that sometimes like, it can be a lot to be a friend and family member of someone who's struggling, and you're allowed to take care of yourself in that setting. You're allowed to put boundaries up. It feels really crummy, but there are specialists and therapists and people like that. One of the ways you can most help people sometimes is like actually physically helping them get to care, right? Because if you're sad or anxious, let's say, the last thing you want to do is spend hours calling somewhere to get in. Like, that just sounds miserable. If you're sad, you don't have the energy to do it. If you're anxious, like, talking to people is like the worst possible thing. So we like basically set people up to fail. Like the way we get appointments. Like, I wouldn't lean into fixing it right away, because we definitely do that too as like a culture. Is like, if you were talking to me, I'd be like, let's get you help right now, instead of like just listening. So lean towards just listening, but if there are ways to help, like a really helpful one is actually like, can I help you like navigate the mental health system? Because it's miserable.
It can be it's overwhelming. There's a lot of information, and you know, for somebody that is going through struggles of that, it could feel like daunting to have to research to try to find what's right for you. Yeah, definitely having support in that area.
Super daunting. Like even helpful. If you wrote the emails for them through their account, right? Like or you made a couple phone calls for them, that you might not be able to do everything because of privacy and all that, but you can probably make it easier for them to feel like they can do it, and that's really important, because if you feel like there's no hope or you feel like the barrier to even like getting care is so far, then like it can get towards more hopelessness. And that's another sort of like symptom, I would say, is like sort of hopelessness comes off in the way people act and talk, right? Like just much more dark. Like if they're not a dark humor person and that's all you're getting, that's probably a warning sign. Like hope can look different ways in people, but it like a lot of like sort of statements that suggest they're not thinking about the future much, or they see like a lot of darkness in it, like could also be a warning.
Definitely. I know another question that just often comes up with, you know, my friend group is that therapy and, you know, seeing a psychiatrist or in general, like, is expensive or is not covered by insurance. For people that have a harder time, I know there's like, I don't know if there's like programs out there that, you know, maybe are more affordable. But, you know, some people are like, oh, I really want help, because I feel like everybody could talk to a therapist no matter what level of mental health they're at. I think it's important, but it's like, oh, I really want to see a therapist, but I don't have the money, and that's, or I don't have I'm not able to financially right now. What advice would you, I guess, give to somebody in that situation?
Yeah, I mean, so most, like, if you have insurance, you should at least have some mental health coverage. If you don't, they're like violating the law, and so you can go find somebody and bring that to them and basically tell them they have to cover it, like out of their own sort of pocket of insurance, because they do need to have somebody on their panel. Like it's just the way it is. If you want a certain kind of therapy that they don't have, sometimes that can be the case too, but it's more work, obviously. If you don't have insurance, can't afford insurance, want to go a different route, the word sliding scale is probably the most important thing to think about, which is like you can Google like sliding scale therapy wherever you live, and somebody's website is going to come up that has that. Basically what they tend to do is, instead of like just charging the same fee out of pocket for everyone, they look at what your finances are and what you bring in, what you're able to pay, and they'll take a certain amount of people on every sort of step so that they're doing some like cheaper, and then they're also taking some of the people who can pay his money and kind of balancing it out. They're definitely people that do that. You know, if you're at work, your work might have free therapy for like 5 to 7 sessions. That's called an employee access program. It's worth looking into, because even if it's just a short amount in sessions, like it's still some. And that's helpful if you need it in the moment, or it's helpful if you want to try it out. Most states have some kind of community mental health place that's like covered by Medicaid kind of stuff. They're really overcrowded and really hard to get into, but you know, they do exist. You just still feel frustrated by the process. You know, something else to think about that probably isn't thought about enough is like groups. So I think groups are really scary to people, because you're like talking about your stuff in front of people, and like that's scary, but it actually is normalizing and nice.
I have some family members that have done group therapy, and it's been like life-changing.
And it's cheaper usually. It's usually more open and accessible, just because there are lots of them and you can find them and go to them, you know, and so that sometimes is a place to start too. If you're just like, I want to do this, but I don't feel like I have the money for this, like group therapy is cheaper usually, and probably less of a wait some places, and you get to kind of experience it, see what you like, and then if you wanted to do something else, you could.
Definitely. Well, thank you for that information. Last thing, because this also gets brought up all the time, is people are scared of medication. For somebody that is afraid of taking medication, or, you know, I've heard oh, I don't need to be on medication, it's not that bad, or a bunch of my friends are on medication, a bunch of friends aren't on medication and don't think they need or don't think it's the answer for them. If you want to just speak to the medication topic.
Yeah, for sure. So I'm a prescriber, a psychiatrist, go to med school, and then because we go to med school, we're able to prescribe medication.
Yep.
You know, for me, when people are hesitant or like worried about meds, I usually ask where that's coming from.
Yeah.
A lot of times it's coming from something they saw on TV, it's coming from a friend, it's coming from stuff like that, and I can kind of break it down based on that.
Yeah.
But, you know, for the most part, it's like just fear of the unknown.
Yeah.
You know, meds for mental health reasons are the same as meds for anything else.
Yeah.
But we just don't view them that way for some reason. I think because it's just not like, you're not like, I have depression, I take meds. You're like, I have high blood pressure. Like it just is different.
Yeah.
You know, but they work. I think people have fears that they don't do anything because they also have friends that were on them, didn't like them, had some side effect or something. And I think all of that is true. All meds have side effects, right? But I think you can find the right one, and I've seen it be life-saving. I think it's important to think of it as a tool and not like the only thing or like something that means something about you. It's just like another thing that you need for now. Like maybe you won't need it forever.
Right.
You know, some people do. Like if you've had multiple episodes of depression or you have bipolar disorder, if you have schizophrenia, like meds are going to be part of the picture.
Yeah.
But if you just felt more anxious now than you ever have in your life, maybe you'll get off them. If you just had one episode, maybe you'll get off of it, right? Like it's not like a
you're
life
stuck
sentence
on it forever.
Yeah.
And that's, I think, what a lot of people are saying is like, if I started, I'm not going to be able to stop. Or,
I mean, it's not addictive. Some of it has some withdrawal, like depending on it coming off of it, but it isn't about being addicted. It's just about like readjusting kind of. It's hard for people to get that. Like you're not craving it. You're not doing things in spite of it, right? But you're that, which is an addiction definition.
Right.
Your just brain is needing a little time to adjust. Like coming off any med, like if you take steroids, you have to taper off of them. Same thing.
Yeah.
You know, I'm on meds. I've been on meds since college. I think I had my own internalized stigma about them, and that surprised me.
Yeah.
But I had to work through that myself. But I think if I stigmatize it, I assume most people do. But that belief that it means you're sicker or something is also not fair. I think sometimes it's just the tool you need. Like if you're sitting in therapy and you're too tired, too depressed, too anxious to actually be able to get anything out of therapy, therapy is useless until you have a medicine. It just is. It doesn't mean that you are so sick. It just means the symptoms you had are not like able to be dealt with by therapy alone. And you're actually, in fact, therapy is like not really helpful right now because of the symptoms you're experiencing, you know? And so I see it not like it means you're worse, but that it's just the tool you needed. And, you know, some people, again, with like bipolar or schizophrenia, meds are going to be a big part of the picture because like they're needed to like save your life in some circumstances. And that's just the way of thinking about it there too. But meds can make it so you like what is interfering with your life is no longer really interfering with your life. And that's huge. Like I have people who have anxiety who worry that if they go on meds, like the thing that makes them work and the thing that makes them do stuff is going to stop. Like their anxiety is actually the good part of their personality, even though it also like interferes sometimes. And so it's never like taking it away completely. Like it's not going 10-0. It's going 10-3. So you'll still care about stuff and want to do stuff, but you just won't not be able to do things that you want to do. Right. And so I think that like when things you're dealing with are making it so you can't do things you want to do, are interfering with your future plans, with the things you want to be doing, with your interactions with friends, with your goals. If meds can make that better, you should take a medicine. Like you should be able to have like a totally fulfilling life. And if there's a way to get you there,
like meds can enhance your life quality. If you need.
Not that I would push them on people who don't need them, which I think people also think psychiatrists do. If you come to me and you don't need a medicine, I won't give you a medicine.
I'm not gonna give it to you.
No, I won't give you medicine. But I think that like it can really benefit a lot of people, and people turn to it pretty late because like by the time they want to go to a psychiatrist or can get in with a psychiatrist, it can be pretty late. But you know, or they were an inpatient and they had a bad experience where people put them on like 7 meds at one time. But, you know, a good psychiatrist is not going to do that.
It's not good,
and there are good ones. I'd like to consider myself one of them. But, you know, meds can be life-changing. They're imperfect, but they can be life-changing. And I think the imperfect nature comes from the fact that we can't scan your brain and tell you what med to take. Like, we just don't have data like that yet. If we could, we'd be much better at picking a med for you and making sure it worked and all that stuff, and maybe sometime in the future. But they do make a difference, and they can really help. And most people, like, when you find a good one, are not like, I can't believe I did that. They're like, oh, I can't believe I waited that long to do that.
Yeah. No, that's amazing. And I really, again, appreciate you coming on, because I know so many people that are just afraid and don't have the information. Like, we don't have the knowledge, or, nowadays we just scroll on TikTok and try to find answers, and we get people telling stories that don't have any knowledge or, have any experience, or they just tell their side of the story. And then that's what we remember. Oh, I watched somebody on TikTok take some anxiety medication and it ruined their life, or they had terrible side effects. And that's like ingrained in our head. So I'm very happy that you're able to come and speak on it from a professional standpoint with your expertise and your knowledge.
Yeah, I would never say like that person's experience is wrong. Right? I very much believe that like what you're experiencing is valid, and like your feelings and your past experience with it is valid. But I do think one of the hard things about TikTok is you get a lot of information a lot of times once you start looking down a certain rabbit hole because of how the algorithm works, and that is reinforcing of the bad, you know? So like, you also are not seeing people make TikToks like, I took an antidepressant and I'm super, right? Like no one's making the happy ones. Like, that's not interesting.
No, exactly.
Like, oddly, you said sort of like the curation of social, like, we do also really like sort of trauma stories and like intense things that happen.
It's a virality.
It's more exciting, right? Like, nobody's excited by, I went to a psychiatrist, they were really cool, they gave me a med, it worked. Like, that's boring. Yeah. And so that's not going viral. You get like 2 people to read that or see that, right? And so because of that, like, you're not seeing that side. So just be mindful that like those stories are probably their experience, but they're also like, you're not seeing the other side. You have no idea what it was that happened to them, what med they took. Right. Like, all of our brains are different. All of our bodies are different. Like, it might have worked that way in one person. It might work super differently in another person. So like, take all of that with a grain of salt. Like, go, I'm having strong reactions to that. I'm going to bring that in and talk to a doctor about it. But I'm not going to let that decide what I do for me.
Right. Definitely. Because, what works for one person might not work for another. And that goes for, I think, pretty much anything in life, too. Everybody has their own experiences with things. Your book tour, you're traveling now. What's next for How Do You Feel?
Yeah, the book tour stuff is funny because I was like told not to do very much of it because it's travel and like not that many people come and all that stuff. But I kind of like stories breeding stories. So like, if people come and feel safe and it's a place that they get seen and then they bring that back with them, that's why I wrote it. Yeah. So I'm going like a couple more places, like which is on my website, which you can look if you want to come hang out. Yeah. But also, really, for me, it's just like, how do I get it in more hands of people who like want to read it, talk about it, make this stuff easier for people to talk about, not just healthcare workers, and making it. I wrote it, spent 3.5 years on it. I'd like people to like find it. Yeah. But it's really in line with my kind of mission as a human. So all of that stuff feels like related. It doesn't feel like there's a book and then there's work. It feels like the book is related to work and what I'm doing. And I think that that's nice too. But I mean, it's obviously just like one part of what I do all day. Like, I'm not an author really, I'm like an author who also is a chief wellness officer of a 5-school institution. Right. So I'm very busy. Yes. But, I hope that people find it and like it and find me and tell me they do. And like, that stuff means a lot to me. So, I wrote it to help people. Yes, definitely. Well, guys, make sure to get How Do You Feel? Where can they find it? They should be able to find it everywhere. Awesome. If you go in a local bookstore and they don't have it, they should be able to order it for you. Same with like Barnes & Noble or something. Right. Like, it's all those places either should have it or you can get them to get it for you. Okay. And you can get it from places like Amazon if you want to. Awesome. Where can people find you online? I'm at Dr. Jessi Gold kind of everywhere. Jessi spelled like Jessica without the C-A. Okay. My real name is Jessica, and I was like one of those kids who was like, there's no E in Jessica. So that's where that comes from. So I was a big Twitter person. That has been complex. So I'm like still sort of on there, but then like Instagram, I try to play around on Threads. I don't really understand it yet. I'm on LinkedIn. I have a bad TikTok. And
I have like a random TikTok
yeah,
too.
I have like a TikTok. I really like started to kind of understand my patients, like, to be honest, because like I see so many college kids. I just want to know what they're seeing. But then like drjessigold.com is like also easy to find me. You can contact me through there for anything.
Awesome. Well, thank you so much for coming on today.
Thanks for having me.
Yes, I'm very honored to have you, a real expert in the mental health space, on here to chat. So thank you so much.
Yeah,
and I wish you so much success with your book and everything that you have in the future.
Thank you.
So
You too.
thank you guys so much for listening today. And again, at Jessi Gold at Dr. Jessi Gold on Instagram. That's where we live
the
here.
The other Jessi Gold, spelled the same, is a porn star, in case you're wondering.
Okay.
I just
so
thought
doctor,
you should know
don't
that.
Forget the doctor.
I just thought you should know that because I've had myself on Google alerts, and sometimes it says like XXX, and so has my father, right? Like it's just interesting. It's not me, I swear, but that's why it says doctor on everything, because I found that person, and
like,
that
that's
was
not me.
That was an interesting experience. Like, you know, her own lifestyle, her own life, but very different than mine, and it freaks my father out a little bit.
I'm
so
sure.
just the doctor part is relevant.
The doctor part is important. So at Dr. Jessi Gold with no E. All right, guys. Thank you so much for tuning in. I will catch you guys next Tuesday for another Unposted Podcast episode. Bye.